Hey, welcome! If you're deep in community health studies, you are in exactly the right place. Over the next few minutes, we're going to break down the absolutely essential role of primary care nursing. Think of this as your new favorite study tool, designed to help you nail that exam. All right, let's dive right in. We're going to go way beyond the routine checkups and shots to really see the full picture, the massive scope and impact these nurses have on the front lines of healthcare. This is the big picture stuff that really matters. Okay, first things first. To really get what these nurses do, we have to understand the world they work in. So let's start with the basics. What even is primary care? Okay, so this is huge. Primary health care, or PHC. This is a key term you're going to want to highlight in your notes. It's not just the place you go when you're sick. It's a whole system that's designed to be proactive, to keep you and your community healthy from the get-go, not just reactive after you're already ill. Now, I know this chart looks a little complicated, but here's all you need to know for the nurse's role. See Layer 1 and Layer 2? That's their world. That's where they operate. They're working across everything from hospitals to home care, which means they are right at the very core of delivering care, helping patients navigate all these different layers every single day. So within that system, what is the nurse's role? Well, as you're about to see, it's so much more diverse than most people think. It's pretty incredible, actually. Seriously, think of them as wearing a bunch of different hats. They're health promoters, they're care coordinators, they're mental health supports, and this last one is so important, they address the social determinants of health. That's another one of those key concepts. It just means they look past the symptoms and consider things like poverty or housing, the stuff that has a huge, huge impact on a person's health. And this slide, it's the perfect visual for how all those different roles actually look in a real clinic. We're talking everything from checking in on a new baby to helping someone manage a lifelong condition like diabetes. It really shows how the nurse is this constant, trusted person in a patient's life. And here's something that's absolutely crucial to get. This role isn't static. It's always evolving. I mean, in some places, RNs can now prescribe certain medications. Just think about that for a second. That directly gets care to people faster and helps cut down those frustrating wait times. It's a perfect example of how the profession is adapting to what the healthcare system really needs. So we've talked about what they do, but let's get into the how. How do nurses make all these complex decisions? Well, it's not random. There's actually a very clear, structured process behind everything they do. Okay, you might want to screenshot this one, because if you're going to memorize one model for your exam, this is it. The 5-step nursing process. It's the whole framework for how they think. It goes from 1, getting information, to 2, making meaning of it, 3, determining actions, 4, taking action, and then 5, evaluating the outcomes. And see how it's a loop? It's a constant cycle of learning and improving. And that 5-step process doesn't just happen in a vacuum. It's all guided by this professional practice model. Now, the most important thing to notice here is what's right in the center, the client. It shows that every single thing a nurse does is backed up by professional standards, ethics, and community support, all to make sure the care is laser-focused on the patient. All right, that's enough of the theory, right? Let's make this real. Let's see how all these ideas and processes actually come together in a normal, day-to-day situation. So, let's take that 5-step process we just talked about and apply it to a super common condition that primary care nurses deal with all the time: high blood pressure, also known as hypertension. So check this out. This table lays it all out. Get info isn't just a quick blood pressure reading. It's the whole history. Take action isn't just handing over a pill. It's working as a team with pharmacists and dietitians. This is how that theoretical model becomes a real, practical, and collaborative plan for a specific person. And remember, hypertension is just one patient on one day. This slide gives you a little taste of the insane variety. Nurses really do provide care across the whole lifespan. It's often called womb-to-tomb care. I mean, in a single morning, they could go from a baby checkup to helping a teen with anxiety to managing chronic pain for an older adult. The sheer breadth of the role is just immense. So, why? What's the end goal of all this work? Well, every single assessment, every care plan, every conversation, it all leads to this. It's about social justice, really. It's about fighting for health equity, making sure that every single person has a fair shot at being as healthy as they can possibly be. So, as you're hitting the books, here's the bottom line I want you to hold on to. Primary care nurses are not just cogs in a machine. They are at the very forefront, driving how our healthcare system evolves. Understanding their massive, expanding role isn't just about passing an exam. It's about understanding the entire future of community health.